What it do, what it do. Welcome back to the Echo Pod, giving voice to community-led solutions. I think we finally found a tagline.
Yeah.
Giving voice.
The Echo Pod.
Echo. Well, guess what? We back.
Yes.
We
We back
back.
and we back.
Back and we back.
For all you Chance the Rapper listeners out there, we back. But I guess, we're really finding our groove. We're really here to have fun.
Heck yeah.
Let's kick off. I guess we'll do some introductions. While we kind of get the podcast started. So, sorry, I don't mean to monopolize the space, but I'll go first. My name is Kevin Sunga. I from Little Manila Rising. I'm the Equity in COVID and Health Outcomes, or ECHO Program Director, and I will popcorn it off to Quincel.
Hi, I'm Quincel, and I'm the Echo Program Coordinator. And I'll popcorn it to Dr. Freddie.
Hey everyone, my name is Freddie Ray. I'm a critical care pharmacist. I specialize in a few different specialties, including neurocritical care, trauma, medical surgical critical care patients, and I've also worked with COVID patients as well. And I just wanted to shout out my YouTube channel, TraumasistRx. Like and subscribe, and you can learn more about healthcare literacy on those channels.
Nice. Man, I feel like we didn't introduce ourselves enough. I'm just kidding.
No. We just want to shout out our Instagram as well, at Echo Little Manila. Follow us.
Really good information. I got to say, Freddie has been a great partner of ours in the COVID work, addressing a lot of the myths and misinformation, which is what we're actually going to dive into this podcast today. And so myths and misinformation, is it still relevant? We're kind of about 2 to 3 years into the pandemic. The public health emergency has been declared over, and we're looking into that transition. But are we seeing right now, are we still seeing the same myths and the same misinformation? And something that we really wanted to point out in this podcast is the difference between misinformation and also disinformation. There's also the idea of malinformation, but to make it a little bit simple, before we launch into sort of the myths and misinformation, is distinguishing, both of those words. Mm-hmm. And so I guess I'll leave it open here. Misinformation. Do you both know what the difference is between the misinformation and disinformation realms?
Yeah, how I see it is misinformation is false and inaccurate info, so the facts are wrong, but disinformation, it's wrong on purpose, with malintent.
Yeah, I think that was an A+ answer right there.
Yeah, I agree with that.
Yeah. So there's concurrence. Okay, good. No, that's exactly the definition. I think it's really the intent of the information. Because we don't want to chastise anyone that spreads misinformation. Their intention is not to cause harm to the public. It's just incorrect information that is possible that can cause harm. But disinformation is the intent to cause harm. So I just want to set sort of that ground level, because we hear that in the news, how misinformation, how myths kind of play into, with lower vaccine uptake, people folks, residents, being hesitant to take COVID tests.
Yeah, I think one thing that contributes to misinformation and disinformation is people's expertise. We are in a world where social media, you can Google whatever you want and you instantly get an answer. But that's not always either the right answer, or that's not the answer in the correct context. Yeah. So that you need professionals, medical professionals like myself, physicians, nurses, all those medical professionals who work in the field to kind of interpret data, because sometimes you can give a person on the street, an article about COVID vaccines, and they might interpret it 100 different ways where that might not be correct. And, unfortunately, that's kind of the state we live in, where we have a lot of good information out there, but it's interpreted the wrong way.
Yeah, a lot of people get information from Instagram and TikTok, but not enough look at reliable websites like CDC, World Health. So it's important that you stay connected with Echo Little Manila, TraumasistRx.
Yeah, and, keep up with the right sources. There's a lot of sources out there that claim they're the Physicians of COVID Alliance of the world and things like that, honestly. Yeah. And even though there are physicians that have, their medical degrees, sometimes that's not even their specialty. And that's also misleading too. So not everybody that's a medical healthcare professional really knows everything on the spectrum of COVID, for example. So
Yeah. There's a lot of, you could get lost in the media. Like, media is so stratified right now. Like, information is so accessible. I mean, something that we see too is just even the use of WebMD.
yeah.
You know, as like being sort of that guiding, you know, just like, oh, like I'm gonna go to WebMD to diagnose myself and I'll have a better sense. But that really doesn't, you know, that doesn't answer, you know, the questions or the issues. Like, really
Yeah.
consult with your doctors. And
Yeah, exactly. I mean, so I guess an example for me is like recently I went snowboarding and I kind of broke my pinky. And so I started Googling, like, okay, like, how do I fix this, et cetera, et cetera. I can do this. There's YouTube channels that talk about mallet finger, which is what I have. But really, they didn't give me the answers that I was looking for. Like, I assumed, like, okay, this is how you treat the mallet finger and all this stuff. But it wasn't until I actually talked to, like, an orthopedic physician assistant, and he told me, you know, all those things about surgery and et cetera, they're not the best treatments. The best treatment is to keep my thing in a splint for 6 weeks, and that came from the physician assistant himself. So you can see how misleading information can be, even for me, who is a critical care pharmacist who deals with trauma and all that sort of stuff. Yeah. So I can only imagine what it's like for people who aren't trained. Like, there's too much information, so you know that's where all this confusion can come from.
Yeah, there's like a lot of information overload, and also with like WebMD, they give you the most severe diagnoses, so it's fear mongering, but it's not necessarily that. Like, it could be something more mild.
In a way, they're kind of, you know, giving you the every scenario possible, which is helpful in a way, but it's also worrisome because you can't, as a like a normal person, tell what it actually is.
Like in a clinical setting, it's called like differential diagnosis.
Exactly, yeah.
But then for community members, it's
oh my gosh, this is all going to happen to me. What am I gonna do?
Like, how do I deal with all
How
these
am I
diagnoses?
going to like die in 6 days, but then I have to go and get this treatment, and then what?
Yeah.
Exactly.
I'm gonna have diarrhea from my medication. I don't understand
Like
which
these
one's
side
happening
effects.
first. So yeah, I mean, it takes like a professional voice who has that like training to like help devise and figure out what you know what is actually happening.
And that's what we try to offer, you know, and like as Quincel and you both mentioned, like these platforms that we're hosting, you know, to run it with like experts such as yourself, and also for you as well, because you have lived experience, you know, working in the ED, and also in your work as community health worker.
You as well, working at UCSF.
Me?
Oh yeah, that's right.
No, that's.
Come on, Kevin.
Yeah.
I'm gonna go hide
Give
now.
yourself a shout out.
No, I appreciate that. Thank you so much. And it all comes back to here, like our focus is community health and to provide the correct information and for you to decipher, you know, what that means in your life. And so, you know, we'll jump into a couple of things. We want to talk about the impact of community health, where we're at right now with vaccines, and some of those myths and what we've seen in the beginning, if they're still relevant, and also talk about to revisit some of even like the vaccine myths.
Yeah.
Because there's bivalent boosters. There's also, you have your monovalent. There's a whole array of vaccines that are available to the public, and you know, it's not as available as much as it was before because of the public emergency. But we want to remind everyone some of the like the safety protocol and to debunk some of these myths so you can make a healthier outcome and a healthier decision. And so the first thing that we wanted to talk about, and shout out to June from Philippine News Today, who emailed me asking this question actually. And he asked, like, is economic inequities and other barriers, are they still a barrier for accessing like healthcare services and necessary resources for safety and treatment for COVID-19? And that is a definite yes. Like, economic inequities here in South Stockton that occur are still a barrier for vaccine uptake. Have you seen any of those stories like in your healthcare settings?
I think one of the big things about inequality is the lack or like the differences in education given to patients, and like the ability to, you know, we've talked in previous conversations about how someone who English is their second language might not actually understand some of the basic things we might just tell people in the pharmacy or in the hospital, like, hey, make sure you take your Tylenol every 4 hours. That sentence to me and you seems straightforward. But for someone who doesn't understand English, that might not sound as straightforward. So you kind of take that idea but multiply the difficulty with vaccines. Oh, when do you get your vaccine? Like, oh, but this causes myocarditis, or does it? Or, should my baby get this vaccine? Should my pregnant sister get this vaccine? And those are people who might not understand the full, educational like meaning of that.
Yeah, for like the economic inequities part, I have seen folks mention like, oh, like I didn't get the vaccine because I think, isn't it not free? Like, how much is it? Like, they have questions like, oh, if I do test positive, like how much do I have to pay for Paxlovid? Like, how about like the monoclonal antibody therapy? So folks like think 3 steps ahead because of financial burden. And it's sad because like we want to provide like quality healthcare access, but if you go through these economic inequities, how are we supposed to help them?
Yeah.
Yeah.
And it really comes down to like what you pointed out too is the access. There's language. I wouldn't want to call it barriers because we acknowledge all the language that do exist. But we do have to make the access to language equitable. So I think equitable language access is how we're going to frame it, but also access to clinics. As we've learned from the pandemic here in Stockton, there was a reliance on community-based organizations or CBOs to increase vaccine uptake to make sure that information was equitable. And so what we're seeing now, because of that public like health emergency scaling back, is there's less vendors. I think at the beginning we had about 5 vendors, moving into the space, accommodating large-scale vaccine clinics, smaller ones, of different degrees. But now we're really down to 1. And so, that leaves us with sort of, short resource to help increase, vaccines, especially ones that are free for our community.
Question for you guys, that just came to my on top of my head. So like so when COVID was designated an emergency, like do you guys know what percentage of the population you were able to vaccinate up until this point, or is there any metrics that you guys have been able to like observe?
Yeah, so I think with San Joaquin County, at the beginning it was like in the low 60s. I would say high 50s, low 60s.
Like
Percentage wise of the county being vaccinated. And current, at least for primary vaccinations, I think we've reached up to about 70. Okay. So it's a huge win. Good. And I think that's the metrics that I've been tracking through San Joaquin County Health, San Joaquin County Health Services. Or public health services, excuse me. But they have that information readily available in SJ Health.
Okay.
Yeah, but that we've seen that increase.
Got it.
Yeah. Yeah. No, it's all good. I think if you hear some voices like here at the center, we have a lot of programming that is here.
Yeah.
That's why we're laughing.
I know.
We can hear too many voices.
Yeah, I thought I was going crazy by hearing voices. No, but anyways, so yes, like we have seen an increased uptake because of community-based organizations, because of the collective work that we have done.
Got it. So with like less vendors, do we project like this to go down, or are we finding ways to like figure out how to increase this? I don't know. I'm just curious, honestly.
Gradually, I feel like vaccine uptake has been going down. Like I just came from a clinic today, and only like 1 person came through, and there's still some hesitancy out there. That's why like us debunking the myth is really important, because some have mentioned like, oh, I don't need it. We're 3 years in, never gotten sick. Like there's still some hesitancy out there, but now that we only have 1 sole provider in the county that is offering free healthcare access to these things, like I do foresee it being difficult, but I think as as we build coalition with other CBOs and hopefully other healthcare systems, hopefully we can increase vaccine uptake still.
Yeah, and that's honestly the strategy is, there's a lot of these vendors that kind of popped out of nowhere to administer vaccines, but something that we can connect is the longstanding healthcare systems that are still here in town. Yeah. So, St. Joe's, Dignity Health, Kaiser, like how do we improve the narrative for them that these healthcare centers are there for them? Yeah. How do we build that trust?
Yeah, we're like the conveners and like the bridge to that, because we're on the grounds and we try to encourage community members to be their own patient advocate by educating them, telling them, like when you go to these healthcare systems and settings, like ask them about these things. Like, don't be afraid to like say all your symptoms. Like
Yeah.
they're there for you.
Exactly. Oh, that's a good one. Yeah. Shall we keep moving
Yeah,
forward?
no, that was a good question. No, that was thanks for like opening that
Yeah,
space
that
up.
was totally unplanned. But I'm just curious because from my perspective, I do see the situation with COVID because we're getting more people vaccinated as a whole. Like it's becoming less of a crazy issue. I mean, we still have PPE and we have a bunch of patients in the medical surgical floor still getting treated for COVID, especially like if they're vaccinated or the elderly or immunocompromised and still not kind of getting over COVID. So we got to help them, giving them Paxlovid and all those other treatments. But I do see that because of like the work you've done and other sorts of relatable communities, organizations, we do see that vaccine uptake is beneficial. And we're seeing those fruits kind of like bear now. Like we haven't really had a winter surge and all that sort of stuff.
Yeah, and I'm seeing like less ICU admissions and deaths from folks who have gone vaccinated.
Exactly.
That's good. I'm like, that narrative, and thanks for introducing that. Like, what is the solution? Like, what are we looking forward to, like, in this work? And, our attitudes to driving up COVID vaccines, that also can apply to how can we also drive up, like, flu vaccines, like monkeypox? So how can we keep that relevant? But I think you just prompted us for another topic in a later podcast.
Thanks for coming to the Echo Podcast planning meeting.
Yeah, I know. Yeah. Welcome to our brainstorming session. But you have a good question though. It's but what about now? Bivalent boosters. Like while we still have the resources now, because we still have that one vendor, San Joaquin Health Center, to help us, and we're being strategic by looping in other vaccine and also free health screenings. But there's still a push for bivalent boosters. So a large part of what we want to talk about today are the myths.
Yeah, let's just dive in,
we're
unless there was
going
other
in.
things on our topic.
No, you're on top of it, Freddie. Yes. So should I get? Sorry, I was like, I was very confident. Woo! All right. So should we get the bivalent booster? Like, does it matter? Like, okay, I'm a resident. Like, oh, I got my primary series. I already got COVID. I'm so prepared to get COVID now, and nothing's gonna happen to me. Should I even get the bivalent booster?
Yeah, no, I think that's a super common question in today's COVID world. So we're in March 2023, if you didn't know that. But anyways, a lot of people have gotten the monovalent series and are boosted at least 3 or 4 doses. They haven't gotten their bivalent. They probably got COVID at some point, like myself. And, they're asking the question, like, should I even get the bivalent? Is it worth me taking a couple of days off because of the symptoms that I had with the monovalent? And what we're seeing in recent studies about the bivalent versus just the monovalent vaccine is there is some inherent benefit. Yeah. We're seeing significant percentages of people not getting reinfected. And if you are someone who is elderly, so again, age 65 and older, people who are immunocompromised, those are the high-risk groups that we should really focus on. So if you're in that category, or you're someone who's had a history of cancer treatment that might be younger than 65, you're someone who's around high-risk individuals like elderly people in your home. So we talk about multi-generational families a lot. So your Lolas. If you're around them, or even you're taking care of patients, the benefits of getting the bivalent vaccine outweigh the risk of, a couple days of symptoms that you already experienced in the past, and also outweigh the risk of getting COVID, because COVID is getting more and more infectious, especially as we get more and more variants. Not necessarily that more variants will be worse for you, but it is more contagious. We do know that, right? Yeah. So definitely, if you haven't gotten your bivalent, you should think about it, get it scheduled at least 2 months after your monovalent booster. Or I would say, 3 months if you got any monoclonal antibodies, but at this point, we're not really treating with that. Yeah. And I would say at least before winter 2023, if you're even going to prolong it that long. Yeah. I think it's definitely beneficial.
Okay. What makes a bivalent, so for our audience here, like what makes a vaccine bivalent and monovalent?
Yeah, no, that's a great question. So monovalent basically refers to when we had the original COVID strain. It was one strain of the virus. Mono is one, and then valent just has to do with the variation of the virus that's in the vaccine. So bivalent has two different strains of the vaccine. It has the original Wuhan strain from back in 2020, and then it also has the new BA strain, BA4 or 5 strain from end of 2022. So now you're prepared against probably like 90% of all variants, because we know that ever since 2022, we had the BA Omicron scare, and that kind of had a bunch of baby variants, and that turned into like XBB, which is what we have now.
Baby
Baby
variants.
variants.
Slap the diapers on those variants.
I mean, that's basically what it is. Like, you
From,
think
like,
about
Delta to
like a
Omicron.
family of BA. It's just basically, you have your
Lineage.
Omicron, Delta lineage sort of thing. So you're protected against all of them if you get bivalent. So why not give yourself that extra protection, especially if you've already got the monovalent vaccines? And we've seen that with the studies from Israel and even studies here in the United States, there are inherent benefits, especially if you're high risk. Yeah, so definitely if that's something you're thinking about and want to stay up to date, get your bivalent vaccine. The one thing I'll say on the flip side is some people have already gotten their bivalent vaccine and are asking, so should we do this yearly? Should I get it's been 6 months, I just got my bivalent vaccine. Should I get another one because I'm going to go travel on the other side of the world? Which is a valid question to ask because we don't know. I would say data states that the one bivalent vaccine for now is okay. It's not gonna give you any extra benefit to get multiple bivalent vaccines because we know that with the current variants, you're already protected. And one thing I'll say is that just to be flexible in the future in case we do have different strains and different sorts of vaccines. Like we have flu vaccine every year, it gets updated because every year the flu vaccine changes or the flu virus changes. And then one thing I'll say is to have confidence that once you're fully vaccinated, so you have your 3 monovalent and then your bivalent booster, that you should feel confident that that's protecting your immune system as best as we possibly can scientifically. So definitely,
I know there's
go
talks
ahead.
about getting like another booster in the fall, but yeah, like you mentioned, there's not data right now showing that you need to get another one.
So I wouldn't forcibly get another bivalent if you already got one last fall. I would just wait to see what happens with the data. Our immune systems are very complicated, complex, but very strong components of our bodies. There's multiple layers. It's kind of like a military. There's multiple different regiments, and okay, this cell attacks this. They're like, you're basically educating your cells when you get the vaccines to fight the virus. I mean, it's pretty complex. So have confidence in your immune system. Yeah, once you get the vaccines, I think you're pretty good.
I don't.
Yeah.
I'm just kidding.
So that's a long answer to answer that myth, but yes.
Yeah, like bouncing off of that myth, like some community members to this day have asked, like, what's the point of the booster if I still get infected? And especially for the young, healthy folks. So I've mentioned like the purpose of the booster is to help you basically like bounce back faster if you do get sick, because I personally went through it during this winter season, and like I was just literally just chilling at home. Like, I mean, I had like the lingering cough and like occasional fevers, but it wasn't that bad. Like I got my bivalent booster like a month or 2 before that. So yeah, I trusted the vaccine and it wasn't that bad for me. And it also like keeps you out of the hospital too, like from severe illness. So without the updated booster, you're more prone to getting these severe symptoms. So yeah, why not get it?
Yeah, so again, for high-risk individuals who have gotten a monovalent but get exposed to like a more recent strain, they put themselves at somewhat of a higher risk for going to the hospital. And like you said, you're basically shortening your duration of like infection, or you're having a better, quote unquote, better infection than someone who would be at home miserable, can't move, super fatigued, and all that sort of, and coughing up a bunch of mucus. And instead you have a better outcomes. You have an easier infection. I'll just say it like that. Because you got the bivalent, you already trained your immune system to like, okay, this is not a drill. We have COVID in our body. This is the real thing. We're prepared for this. It's the same idea. Like, honestly,
We've been practicing.
We've been practicing. We already tested. We already got, taught by the bivalent vaccine what to do. This is not a drill.
It's an
Practice.
instructor.
It's the same idea, honestly.
See, as a military now.
Yeah.
I guess
That's
that's running
literally
to,
what it
yeah. So it's training up units to fight against.
Exactly.
Yeah.
It's target practice.
It is.
Your vaccines
yeah.
are target practice.
Exactly.
Basically, that's
They're
what
like,
it is. All right, that's not COVID. That's COVID. We gotta get the COVID, and then
Yeah.
boom. Yeah, that's like the easiest way to think about it.
Yeah.
So, anyways,
No, that's a great way to put it in perspective, and that's a little bit of what your white blood cells do too at the same time.
exactly.
Yeah.
I mean, like that's part of your immune system. So everyone target practice for the whole team.
Yeah.
All right,
Squad.
let's keep a. Oh. All right.
So yeah, I think the one thing that we really did want to address is the earlier sort of like study, or the study that was released sometime, I believe this year, of how the bivalent Pfizer vaccine may increase the risk of stroke in people age 65 and older within 21 days of getting the bivalent vaccine. Is that true? What's going on with that?
Yeah, so some context is earlier this year, right? People were wondering, like, should we even get more vaccines? Because in a very small study that looked at one marker, so just to give everyone who's listening here kind of like a background, there are a lot of different surveys and sorts of systems that look at vaccine safety. And one of them looked at there's a slight spike in strokes for people age 65 and older. So that is that. What I'll say is that no, the vaccines don't directly cause strokes. Yeah. If you think about it, when we first had COVID increased the risk of strokes in hospitalized patients way, way more. Yeah. So if anything, we should be worried about patients getting COVID infections because that could increase your risk of stroke. So what this article, I think, should give people confidence in is that the FDA, the CDC, are actively looking at how our vaccines are doing. Yeah. So what would cause me to worry is if we looked at all of the different sorts of safety systems that we have in the United States. So we have the FDA survey, we have VAERS, which is another vaccine adverse effects survey. We have the CDC looking at stuff. We have Pfizer even doing backtracking on their data, so phase 4 studies and all that sort of stuff. If all of those entities said, okay, everyone here is saying the same thing, they all cause stroke, then I would be worried. But I think this study should give confidence in the public, saying that we're looking at this. Maybe there's a slight risk in one survey, but the rest of the sorts of organizations do not think that this is the cause. So we shouldn't stop treating people and preventing COVID infection because there's way more benefits. And in the end, COVID actually causes strokes more higher rate than vaccines.
Yeah, it's kind of like how medication, when they advertise it, it's like it's going to treat this, but watch out for all these symptoms that may happen. And it's like usually a long list.
It's a long list because these are the potential things that could happen, but we're also watching it. And if anything changes, at least in the medical field, we always get updates, or I always sign up for updates as a pharmacist. These are the new adverse effects for this medication, this vaccine. So I already know, and physicians and prescribers already know that too. Yeah. So I hope that this gives confidence to you, the listeners, that there are many different safety systems that help us determine whether the vaccines are safe or not. And there's no strokes that will be caused by vaccines at this time. There's pretty good confidence that this will not happen. There's no relation.
Yeah. You heard it here first. On the EchoPod.
Yeah.
No, thank you so much. I know we're wrapping up a little bit, in just a few here, but the one thing I actually really wanted to talk about, to kind of plug it in to, current events recent was the Damar Hamlin, situation where he collapsed on field. And there was that huge myth of, the vaccine is what induced myocarditis. So Freddie, do you mind walking us through myocarditis really quickly and sort of around that?
Yeah. So Damar Hamlin was playing football and he got hit in the chest like normal, and it ended up stopping his heart. And some people right after that incident were on Twitter and social media saying, this is all caused because these athletes, their hearts are stopping because of the vaccines. And some people attribute that to myocarditis, which is inflammation of the heart that is a symptom, a rare symptom, I'll say, of COVID vaccines that we only see in a very small part of the population, and that is young male patients. So age, I want to say in their teens all the way up to 17, we have seen a very small marker that these young patients may have some slight myocarditis. But what I'll say is the rate of this happening is maybe like 5 to 10 people in a million. It's like a 0.00% sort of number. So to put that into perspective, it's a rare thing that happens in the vaccines that we have seen, and physicians are all aware of that. So if you have any heart issues, I would talk to them. But that's in comparison to COVID, the infection itself. COVID can actually has a higher risk. I think it was like either 10 to 20 times higher risk of myocarditis from COVID infection than the vaccines. And we know in general, viruses can induce like the heart to be inflamed. So myocarditis, if you didn't catch what I just said, is the inflammation of the heart, and that can cause chest pain. That can cause you to have troponins elevated, which is the heart muscle kind of leaking out proteins into your body, which is just something that we know happens when the heart is damaged. But if you have any of those chest pain issues, anywhere radiating from the chest all the way up to your arm and up to your chin, right after COVID infection or during COVID infection or after the vaccine, I would definitely talk to your physician about that. But to kind of wrap this up, the vaccines do not increase the risk of myocarditis in everybody. There's just a small population that if you have any questions, talk to your pediatrician.
Okay.
Yeah. One thing I'll say is that what did happen to Damar Hamlin is something called commotio cordis, which I'm not a cardiologist, but what I know of it is that he got hit at the exact time his heart was beating a certain way, and what can happen is it just disrupts your heart rhythm.
So he
that's
had like
what
an
scientifically
arrhythmia?
happened. Yeah, kind of like that. It basically, your heart is a rhythm, and when you interrupt it by getting hit in the chest, you can cause the heart to stop because it doesn't know, like, okay, is it time for me to beat? You know, it loses that sort of impulse. So that's what actually happened to Damar Hamlin, as far as I'm concerned. But it wasn't vaccine related. And again, like when we look at athletes and healthy people who do die suddenly, this is just kind of a reminder that it's not because of the vaccines. You have to kind of look at further what is actually happening to the person, because everyone's different.
Yeah, they're like congenital history. How they were born.
Exactly.
Yeah.
So you got to take that all into account versus going straight to the vaccines.
Yeah.
So.
And you wanted to give a shout out, Kevin?
Oh yeah, I do. No, really, and this is a shout out to the Bill's assistant athletic trainer, Denny Kellington. If you're by chance watching this, just like who administered the life-saving CPR that saved Damar Hamlin's life. Shout out to him. Shout out to everyone that put themselves in the front lines, whether it's in a traditional hospital setting, in residence, and also even in sports, who keep our athletes safe. So just like all around, thank you very much. And, I want to thank you, Freddie, for, clearing up some of the myths. And I just want to say some. There's a lot.
We had a whole list.
have
We only got to like 3. So maybe we'll have to do a part 2.
Yeah.
Maybe there's follow up. But we had like a million myths to kind of go over.
A lot.
But I just want to say, like, if you have any further questions on the myths we did talk about today, please let me, Trumpsys RX, or Echo Manila know so we can address that ASAP. But hopefully that was pretty clear. Yeah. There's a lot of misinformation, like we talked about out there, that will that will turn your mind into thinking about certain things. But we have to stick to what is the facts. What do we scientifically know? And things can change when we do more studies, which is something that I'll put like asterisks on. Like, things can change if we do more studies, but what we know so far, with the extent of 7 billion or however many billion people have gotten the vaccine so far, they're very safe. So that's like the message that I'll leave with you, at least from my medical standpoint.
Yes, vaccines are totally safe.
They are, and we're gonna, and we as community leaders and community health workers, trying to bring those opportunities and mitigate the barriers, and you trying to get those opportunities, based on the science, based on the facts. And as what Freddie said, if you have any other myths or misinformation that you'd like to get cleared up, at Trumpsys RX, at Echo Little Manila. And Quincel, anything else to add to close us out, to kick us back home?
Yeah, we'll debunk those myths through our social media, maybe our future IG Live.
Yeah.
We're here for you. So thank you for tuning in.
Thank you, guys.
To Echo Pod.
Thank you for listening in. We'll see you at the next one. Bye, y'all.
Bye.
Echo.
That's our new song, Echo.
Echo. I like
I
this
like
song.
that Chance the Rapper.
Way back.
Yeah.